what are the symptoms of you having skin cancer or oral cancer? Well, uh, having just a bump, they're very, I would say, very difficult to actually notice because some of them might seem very normal and like nothing you would really pay attention, but you should. You have a bump that simply appears somewhere on your skin or on your tongue. You have a sore that it's taking like a lot of time to heal. Doesn't have to be necessarily painful. That's one of the things that people don't worry about because just, I mean, you have a sore, but if it doesn't hurt, you're gonna probably just ignore it. If you have a spot on your skin, doesn't have to be a dark spot. Actually, there's something that is called actinic keratosis, which is associated with sun exposure. It's very, very common among people of, I would say, older than 45, even 50, which are some white spots on their hands or on their head if they're bald, or on their face, which are hard, and it's like white, like pearls. That is called actinic keratosis. And it's a pre-malignant lesion. So not only look for dark spots, but also white spots. They can also be a symptom. Um, of course, uh, blood vessels in the center of any bump or anything that appears on your skin, uh, like this little purplish lines that go to the center of the spot. That means it has blood supply there, so that's something you should take care of, or get seen, because that's suspicious. Well, like I said, the pearl and hard black spot, and changes in moles. And there's something that is called the ABCD of moles that you should really know and like apply. This is basically it. A stands for asymmetry. That means if you take your mole and you kind of divide it by the middle, both halves should be very similar. As you see in the picture there on the right, in the A, you'll see a mole that is very asymmetric. One half doesn't look anything like the other one. So that's something you should take care. The B stands for border, which basically means how regular the border is. If you see on your left, which for somebody might look like a very nasty mole or something, but if you see, you can see that the borders are very defined, very neat. In the other hand, you see the one on the right, which is like, it's very difficult for you to draw a border. You don't know where it starts and where it ends. So that's definitely a sign that you should like pay attention to that mole. C stands for color. Again, if you see the one on your left, it looks like very dark, but the color is very similar no matter where you see it. But on the right, you can see it changes colors. Like it's darker on the left side, and it's like, I don't know, like it has certain darker spots or points. So that's also something you should watch for. And the diameter, which is the D. Anything bigger, I would start paying attention to everything less than 0.5 centimeters. And not only, I mean, talking about size, not only the diameter counts, which is important, but how fast it is growing. So if you have a mole that you don't know that might have certain of these A, B, C, or D, and you are worried, take a picture of it, or at least look at it every day to see if it's changing. Also, if it's bleeding for no reason at all, then that's something suspicious. So just take to account this A, B, C, and D, which is very useful.